Okay, hi everyone. Okay, we're gonna do lip filler or beautiful lips. So you have nice shape, okay, of the lips. The lower is bigger than the upper, that's natural, that's normal, okay? And then the shape is also very well defined. So what you have, we can only just augment what you do have. We don't have to create anything, okay? We'll do a little bit on the lower. I'm gonna probably do a little bit more, make the upper a little bigger than this. Our focus is gonna be more on the upper, okay? Just relax like this. Meanwhile, while I'm doing this, actually let me just numb your upper lip more while we're finishing the lower lip. So that hopefully will be more numb. Open your mouth a little bit. Okay, good. Put this in there. You're comfortable? Okay, I'll let you know what I'm doing. So open your mouth a little tiny bit. I'm just taking measurement, and then it's gonna be a little pinch, small pinch. That's superficial. How's that? Okay, and then I'm injecting. We started. We're doing this with Versa lips. A lot of you already know the Versa, and then now Polinium, the company that produces Versa, they have Versa lips. It's a product that's specifically for the lips. It comes in a nice pink box now instead of the black one. It feels like smooth shape for the lips and supposed to also last longer. The syringe is still 1.2 cc compared to the other fillers, hyaluronic acid fillers that have usually 1 cc. So there's 20% more volume in the syringe. You can see it here, 1.2 cc's. We don't necessarily use it all if we don't need to, but it's nice to have a little bit more just in case. Okay. So open your mouth a little bit. So you saw your friend's lips and said like, I want these too, or something? Okay. Other side. So the lips swell fast, bruise fast, but also they heal fast, okay? And then as I'm injecting you, you're gonna start feeling numb even more because it does also have a lidocaine, numbing medicine, in the filler itself. So I'm injecting both filler and numbing medicine. That's why also it becomes a little easier as we work on you more and more. As I said, your lower lip didn't really need much, so we're just enhancing it a little bit. Okay. And then little pressure. How long did you numb your lips out? You were sitting there and numbing for like 15 minutes at least? Okay, good. So that helps this way. Okay, so for the upper, I'm gonna put the back a little bit more. Good. So we'll do the Russian technique for the upper lip, or the fencing technique. To give more projection and more volume for the upper lip. It's good to do that technique for the upper lip.
And pricing?
Pricing, you know, it depends on the product that we use. You know, we have like really great promotion on Versa lips. It's usually 500, but Ingrid, she's great. She'll get you a discount from the company for $50 instant rebate, so it becomes $450 only for now. Okay. Alright, just do this side, and you're opening your mouth, so that's great. Let's take this down so you can see. You see these columns? This is what's called the fencing, you know. Smoothen out. Smoothen it out now, and then over 2-3 weeks, they'll be even more smooth by themselves. But these are the columns that we are creating with the filler. How you feeling?
Good.
Tagliali, she sounded good. Patient. So this will also give some more volume to the Cupid's bow angle. And come from this, you see how it lifted up. And then we'll just add a little bit volume. Alright, let's just give you a little break. Apply a little pressure. Okay, if you have any questions, anyone, please let us know in the comments below. And this is the angle of the mouth. A lot of people also they want to fill it. We're filling it. We're not gonna overfill the angle. You don't want it to be too thick. Then it doesn't give really good shape when you have it as thick as the middle. So it becomes like sausage. So that way we augment the corner of the mouth, but we don't overdo it. So we'll just do the other side, and then we can always go back and look at everything. Do the same thing. You can see she grimaced a little bit. That's normal when we first start the side because it doesn't have any numbing. Now should be slowly easier. Okay. Looking good. So you can see the huge difference in her lips, but part of it, this is swollen, so it's not gonna be really that big after the swelling goes away, but still gonna be, of course, more plumpy. See this side almost stopped the bleed, so that's good. I'll apply a little pressure, intermittent, and then it'll stop all the bleed. There's a difference of this bleed, what's called skin bleed from the bruising bleed. The skin at the entry point is gonna bleed like this, but that's gonna stop and usually does not bruise. The lips bruise or the skin, if we hit like a vein or a vessel, an artery a little bit deeper, that's called the bruising. All this little bleeding from the skin that you're seeing, that's not gonna bruise. So far, doesn't seem that she is gonna bruise. So all gonna stop, like a few minutes of pressure will stop all that skin bleed. Again, the corner of the mouth, the upper, we'll fill it nicely and gently. Keep everything natural looking. We'll try to augment the normal shape. Okay, so now that's as I told you, we can a little bit smoothen out the injection without being too aggressive because we don't want to displace the filler that we just injected. Okay. Open your mouth a little bit. Give me a smile. Okay, so you see everything is smooth. This might have a little bruise that, you know, will heal. You can just apply a little pressure. How you feeling?
Good.
Okay, almost done. Gonna sit you up, you know, take a look. If everything's fine, then we don't need to do anything. Yeah, very tiny little amount in the syringe, as I told you, this very tiny amount. No need to use it all. But if we're doing other filler, by this time we'll be out. The good thing about this, if we don't use the whole thing, it's okay. But if we need a little touch up with this one, then we could correct. That's the beauty of having a syringe of 1.2 cc instead of 1. Okay, looks beautiful. You're gonna sit you off. Okay, open your mouth again, little smile. Okay, perfect. And put a little arnica cream. Voila. And then we have the mirror. This is new you.
Thank you.
No problem. Looks great. Looks great. Okay then. Thank you everyone for watching us, for being with us. We'll see you next time.